Welcome to the Flow State Podcast, where we're all about finding balance. We're your hosts, Monica Groney
and Nora Candido. Now let's get into the flow.
Welcome back, Flow Staters. It is episode 1 of season 3. We hope that you've all had a good few months, a little break. You're glad to have us back. Today, we are launching into season 3 with a special guest. We have Dr. Lana, who is a certified naturopathic doctor and a licensed acupuncturist. We have chatted before and talked about the clients that she treats that experience PCOS. So today we're going to dive deep on all things PCOS. We're hoping that you learn something. We're hoping that we answer some of your questions. But first, I'd love, Lana, just for you to share a little bit about yourself and how you got into this work.
Yeah, so thank you so much for having me on. I'm really, really excited to be connecting with you guys, and then also to find out some of the other connections that we have outside of just Maria, which I think is so, so cool. So I am, like she said, a naturopathic doctor and a licensed acupuncturist. Just like I would say almost any other person that got into holistic healthcare in some way, shape, or form, I got into it the same way, which is some sort of failure, if you will, of the conventional medical system. Either a failure or an overlook. I think failure is a little bit of a harsh word. But growing up, I had a lot of anxiety, definitely linked to IBS symptoms. And when I was more nervous, then the IBS would flare. If my stomach was off, then I would obviously have more anxiety conditions and or get really more depressed and as well, just due to the discomfort of my digestive system. So, after over a decade or so of trying different things and to no avail, when I finished college down at Tulane in New Orleans, I came back to my hometown. And as you know, the food down there is just the lifestyle in general is a whole different kind of story. And so I was definitely not at my optimum after 6 years down there. So I ended up going to the same clinic that I went to when I was 16. And there was a doctor there who was young, fun. She ran marathons. She was super relatable. She actually had me crying within like 5 minutes of the first appointment, which I'm not a crier. And so I just felt heard and felt seen for the first time ever. And that was huge. It was obviously so impactful that I'm now a naturopathic doctor. I went to the school that she went to 9 months later after I met her. I even had her come out to the parking lot and meet my mom who drove me to this appointment. And I was like, I'm going to be her. And it just like changed the entire trajectory of my life. And so I ended up out in New York. I went to this school she went to in Arizona, ended up in New York. That's where my practice is currently in Flatiron. And I work with the same type of patient that I was. And I'm trying to be the doctor that I needed at my age. So I work a lot with gastrointestinal issues as well as balancing the nervous system through all sorts of hormone balancing, which is considered endocrinology in that sense. So PCOS came to me by chance. And I think that was from all the really, really highly intelligent, highly driven women that are in New York who want to get off birth control, take their hormones back into their own hand, and really not take extra medication that's not necessary, and really understand what's going on internally. So I give a lot of the kudos to my PCOS patients from just the driven, amazing women that I have in my practice.
Yeah. I'm curious to know your experience about crying in your doctor's office. Like, will you share a little bit about that? I just found that so interesting, and I think it would be an interesting story.
Yeah. So have either of you been to New Orleans?
I haven't.
I have. Yeah.
Okay. Well, it's very, very fun. And the food is super heavy, and it's a 24-hour city. And so I was just exhausted. I was bloated. I was pale. I was just it wasn't cute. Let's put it that way. I was not myself that I am today, even though I had an inkling of that in my eye. You could see it, right? And so I grew up super healthy. I was a ballerina. I danced my entire life. And you just kind of go to the wayside when you're in college. And that was me. And, not ashamed of it whatsoever, super proud to tell about it. And she could just tell that I wanted to get better. And she could see that I was hurting. And she even said that. She goes, I'm looking at your eyes and you just look a little lost. And I mean, I have chills, even like full body goosebumps, even saying it.
Me too.
Because that's not something that people say to somebody. That's not the honesty that you get in a medical office ever. Um, because it wasn't about a diagnosis or a condition, it was just my soul. And to me, that resonated so much. And when she said that, it was just 100% waterworks. Um, and she didn't tell me it's okay. She didn't try and comfort me. She just let it happen. And that hadn't happened either. So oh my gosh, it was the most pivotal moment of my life there in Wichita, Kansas at the Reardon Center, which is where she was. It's where I'm from. And I just forever will be grateful for that exact moment. I mean, we drove to the school that I was at. I'd left New Orleans, went back to Wichita to get a master's in exercise science. And I wanted to open gyms and do all this stuff with nutritionists in there. And I ended up going to the registrar that day. I just like hijacked my mom's day, went to the registrar and switched all my classes to pre-med. And then from there, within 9 months, I was already down in Arizona. So it was really, really fast.
That's so cool.
That is so cool. And I feel like people listening to like wish to have those experiences with their doctors, right? You want someone who like can see into your soul and really be like, okay, you need help and like I'm here to do that. And so often that's not our experience. So it's amazing to hear that you had that experience and now are trying to create that experience for more people.
Yeah, I so often hear this from my clients too, in that those providers likely aren't even comfortable with those emotions, and they're so quick to say like, yeah, like you said, it's okay, or like even if it's validating to hear that like they see that you're having experiences, being able to help you just sit with those emotions too. I think that that's really, really powerful. And I love if you're hoping to create a similar environment for your clients too.
Thank you. Yeah, it was wonderful.
Okay, so today we really want to dive into PCOS. This isn't a topic that we've covered on the podcast yet. It sounds like something that you experience a lot with your patients, and so we're excited to talk to you about it today. I think I personally don't have a ton of experience with PCOS, don't know that much about it. I experienced PMDD, so that's where a lot of my personal research and focus has gone. So maybe can you just share what is PCOS?
Totally. So it means polycystic ovarian syndrome or polycystic ovary syndrome, either way. And what it really is there's different etiologies or origins of the actual condition, but there's a few different bodily systems that are included. And so there is the hormonal aspect of it. There's also the insulin and blood sugar management portion of it. And then that can lead into a lot of other things. There's also an adrenal portion as well. Um, and so with each of these different types of basically origins, it affects different systems. But what all of those systems have in common with one another is that they're all hormones. And that one, if it's high, can affect another one to make that high. Or if one is high, then that one will directly make the other one lower. And so it's this intricate system of hormonal relations that can create all these different symptoms. So insulin is usually mismanaged in PCOS, or blood sugar is mismanaged. And what that does is that will drive insulin to basically be higher at inappropriate times of the day. So insulin usually is supposed to increase after you eat food to help shuttle the glucose into the cells to use as energy. Any glucose that's kind of left in the system after that either goes into the muscles or the fat cells or the liver to be stored as glycogen, which is stored sugar, to then be used later, right? So in PCOS, a lot of times there'll be a lot of glucose. Like let's say that it's driven by diet or a heavy carb diet. When you're eating a lot of more of those sugars, then the insulin, there's either not enough insulin that's released to actually put all the glucose into the cells, or the insulin is not responding to the influx of glucose. And so there's just a lot of high blood sugar floating around in the system. And that can create systemic inflammation and wreak havoc. So that's one. And some of the havoc, if you will, would be like weight gain after really not changing anything in your diet or not even changing your exercise routine, which is what is really the very first thing that people will come to see me for is I'm gaining weight, but I haven't changed my diet. I haven't been working out. In fact, I'm doing a ton of spin classes and all these HIIT boot camps, which is not the right thing to do at that point because of cortisol. And so they're like, something's obviously wrong. On the hormonal aspect, it could be there's two different things. There's usually an estrogen dominance and a lower progesterone level, which the higher estrogen dominance, that can create all sorts of different symptoms, like especially what you had with the PMDD that you're talking about. A lot of those mood swings and all of these, just the classic PMS picture that you see that was obviously heightened for you with PMDD. That's very similar to what PCOS patients do feel when they are actually cycling, if they do. They get very emotional, can't really regulate those things. And then they could even get like extremely tender breasts, all the weight or water retention and all of that kind of stuff. So that would be the estrogen and progesterone portion. Now, what a lot of people think PCOS is it's really hyperandrogen driven. Okay, so that'll be like the inappropriate hair growth. So girls will start to get more like facial hair, whether it's a sideburn, potentially a mustache, chin hair, sometimes on the nipple hair, or like in that happy trail area. I wish I knew the anatomical name for that area, but I don't. But everybody knows what I'm saying when I say it. And so there's that. They could get really, really deep cystic cyclical acne around their jaw and chin, which could really be painful and really throw a lot of women off that are just, their skin was fine before and all of a sudden it's just painful and out of nowhere. They could also get hair thinning, aggression, things like that. And so there's different symptoms and different kind of categories of PCOS, but usually there's going to be the sex hormones involved, DHEA, which is the precursor to cortisol and the androgens involved, and usually some sort of insulin or HbA1c will be off as well.
This was actually my personal experience when I came off of birth control and experiencing post-pill PCOS. And so maybe that's something that we can just share a little bit on here. I never got a diagnosis for it and had to figure all this stuff out on my own. And I was already a dietitian at this point, and that's like you shared in the very beginning. A lot of us go into this work because of our own experience. But I think it's such a interesting kind of, how you've talked about there are different types and different drivers. Maybe we can just explain a little bit more about like what does post-pill PCOS look like?
Yeah, of course. And thank you for sharing your story as well. Because that's where I think a lot of my patients come to me from is they want to get off the pill, just like we were saying. So often when you get on the pill, we're very, very young, and our parents didn't know because it was such a thing and everybody did it back then. So it's hard to not get upset and blame, but that was the thing. And there wasn't a lot of research about it then. And so I think the birth control pill, what that has done is let's say you're, 12 years old and you're getting really painful, heavy periods. They're super irregular and you're just bleeding a lot and you can't really understand why there's acne at such a young age, right? See, and that's really, really sad.
Minus the acne, but for me.
Yeah, and to be that young too. And so what happens is the doctor in the white coat would be like, okay, well, let's just let this girl have her preteen and teen years, put her on the birth control pill because that's what they're taught in school. There's no real discussion about lifestyle, diet. What does it mean that you have acne and why do you get it at these particular times? So they're just throwing on a Band-Aid from such a young age. And then, you go through your high school, your college, your young, early 20s and all of that, where you're just kind of figuring out who you are. And then all of a sudden you're like, well, wait, why do I need this at this point? So when you specifically, Nora, when you got off of the birth control pill or whatever sort of hormonal form it was, those dysregulations and imbalances from when you were 12, those were never resolved. And so you had this kind of like low level, I hate to use the word festering, but it was kind of festering there and just kind of there. And there was a Band-Aid that just covered it. So when you take the Band-Aid off without preparing your body properly prior to removing the birth control by repleting the nutrients and making sure that your cortisol is intact and all of that, then you get that post-pill PCOS that just rears its ugly head with, and what you usually get with post-pill is weight gain, really intense acne. If not everyone gets it, so don't get afraid of it, but you can get intense acne, you can get the hair growth, all the things that I was kind of saying, in addition to really heavy periods and things like that. The issue is that the body was depleted from certain nutrients for so long, for so many years, that when you take the exogenous hormones away, what happens is that you're already depleted. So then the body goes haywire trying to get back to baseline.
Yeah, Monica's probably shaking her head because she's heard me say all these things.
Yeah, I mean, this is like the story.
Yeah, and it's
Oh, this is just like the story that's like we hear, and being in the industry, we hear it over and over and over again. And yet, like the doctors, when they hand you the birth control, there isn't like, and here's the multivitamin too, or like, here's your nutrition plan. Like, it's just like, no, here's the pill. And like, nothing wrong with birth control because it is a great tool for all of us as women, right? Like to have control over our reproductive, like, whether we're getting pregnant or not, that is amazing and such a privilege. But the information is not coming with it.
exactly. Exactly. And I think that that's kind of my mission in my practice, is to really inform my patients what's going on internally. Is this forever? What did you quote unquote do to get there? Because people will ask all sorts of questions and blame themselves when it's not your fault. It was something that just ended up happening and perpetuating.
I think this is a great transition and segue into like, for people dealing with PCOS, who have PCOS, what are some of your suggestions and like treatment plans, or what tools do you utilize to help support their symptoms and hopefully kind of alleviate some of this PCOS?
Yeah, 100%. So what's nice is that my background is in Eastern and in Western medicine, and so I can kind of come at it from two different angles, which I really, really like, and I think it has that much more of a longer lasting effect as well, for patients. So what I like to do is nutrition wise, and I have a nutritionist in our company, which is wonderful. So it's really nice to have that extra support so that I could focus on more of my line of work. But we always work a lot on blood sugar management, on eliminating the higher inflammatory foods. Mainly for this case with PCOS, that would be dairy as well as sugars. And dairy, because of usually the hormones that are involved in the animals that are creating that dairy, or whatever is fed to those animals as well, anything GMO related. So we try and really eliminate or limit it as much as we can. Sugar wise, sugar will drive inflammation and wreak all sorts of havoc. So we just try and decrease that in general. And then nutrition wise, we also focus on like a higher fat, moderate protein, low carb. That's kind of what she really focuses on, which I appreciate because people are afraid of fats. And fats are very, very important for our sex hormones and for our adrenal glands. And I think I probably eat about 70% fat in my diet. And since I've switched to that, I feel amazing. And I just think that we're still a little jaded from that 90s fat-free era that everyone's trying to claw themselves out of. And the moderate protein is actually important just due to the fact that if you have excess protein or a lot of protein in one sitting, a lot of people don't realize that that protein can then turn into glucose and then be stored as glycogen and actually add to some excess weight gain as well if you're not eating the appropriate amounts of it. And so I think that's really important. And it's not something that we want patients to just sit there and Google all day. So it's nice to have somebody actually tell them what to do. When it comes to supplementation, I like to kind of look at it in the different categories that I mentioned earlier. So anything with insulin management, there's a couple things I'm sure you've all heard about, like berberine, which is an anti-inflammatory. antioxidant herb, super good for working with insulin management, and also something called inositol, which is wonderful. And so that inositol also helps with insulin sensitivity, and it helps you sleep at night. And so getting proper sleep is necessary and crucial for any sort of hormone rebalancing, especially cortisol. And so we really like to use inositol there. Um, Working with decreasing hyperandrogenism, which is like more of those male traits. Saw palmetto is a good one, milk thistle. And then we like to talk about like spearmint tea, which is kind of a fun, nice little addition there that Nora also appreciates. And I love that because it's like food is first, and we should really focus on that as opposed to just always supplements. Definitely liver support in general. I mentioned saw palmetto and milk thistle, but there's also NAC or N-acetylcysteine. Nettles root is really good. And you could get some of these in tea forms as well, which is great. Um, to work on the ovarian function, I talked about inositol already, but there's something called Vitex or chaste tree berry, which is also really, really good. Um, the deal with chaste tree is you could only really take it about 4 to 6 months until you really need to understand and kind of reevaluate blood work wise, because if it doesn't work and regulate your cycle by about 6 months, then it's just not the herb for you. It's not your fault. There's just other things out there. Um, and then for decreasing estrogen dominance, we do things like DIM and I3C and calcium D-glucarate, things like that. And then the last one, which I really like to do, is acupuncture. So I usually have my PCOS patients in the city seeing one of my acupuncturists, and I couldn't talk more highly about acupuncture in the realm of balancing hormones and relieving any pelvic congestion, helping with clots, helping you sleep, helping calm you down. And it's a nice little excuse to take a nap in the middle of the day as an adult. So that's what we like to do at the clinic.
I started doing acupuncture probably like last fall, and it's so true. It is the most relaxing, amazing experience. My acupuncturist is like, she's actually from New York City, but very gentle and like sweet, and always spends like 15 to 20 minutes just asking me questions. I like love the experience, and I'm like, if nothing else, it's a stress reliever. It's just like feels like really good self-care.
Yeah, and I think we always really, I think everyone, even practitioners, discount how much stress is bad for us and just how pervasive it is. I mean, if we're all running our own companies here, like you can't deny that you let stress get in the way, right? And you get overwhelmed. And it's just one of the best ways to bring it down.
For sure. I have a question too on the dairy element. And Nora, you might have some input here just from like the dietitian side, but we talked about like hormones in dairy, and is all dairy, like organic dairy, and there's non-hormone like cows and that stuff. Like, is that a thing where there's not hormones in some of it, or is it like the whole industry? What's the word on this?
I'm going to let Nora take over most of this. And one thing is I'm talking about like blanket statement, most of America dairy. That's what I'm talking about. But I would actually love to hear Nora's input on this.
Yeah, I think, I do treat individuals with PCOS as well. And there is a huge individualized component where I like to use labs. I like to use even monitoring with a continuous glucose monitor to help individuals see data and help to validate them if they are experiencing some of those blood sugar irregularities and things. And I think the dairy and kind of gluten recommendation that's broadly advertised is also individualized. And my stance on dairy in general, especially for individuals with hormones and navigating hormonal issues, always choosing full fat dairy if you're going to have dairy at all, and organic. And there are different types, like you were saying, Monica, and even from different animals, like for some individuals having A2 protein, if you've ever seen A2 milk before, that can be better digested by some individuals than traditional dairy. So this is, it's not like, in my eyes, a blanket recommendation, and seeing how your body tolerates it, because you will see the impacts of if you remove it and see a trial run in how that fits for your body, if it's helpful or not.
Yeah. And why is the full fat a factor?
Yeah, so the more you reduce the fat content, they are concentrating that dairy source. So it's going to have a higher amount of the hormones than if you're just doing traditional full fat.
Well, I love that. And that's a great thing because of the like higher fat being beneficial, as well. So I always buy full fat, whole milk all the way.
Yeah, and I love dairy, so that would be a hard one to give up. And that's really good because I just learned two really great important things here. So thank you so much. I'm gonna actually ask my nutritionist about A2 and quiz her.
Yeah, yeah, especially because, there's a lot of overlap with a GI component here. I see when people have GI issues as a main driver for inflammation, that can also then be the trigger for some PCOS. And I think it would be helpful. I know we talked a little bit about hirsutism or like this hair growth, but for other things that I see with individuals with PCOS, if you haven't received a diagnosis before, if you have really, really long cycles, so we've talked about kind of like what a normal cycle length is on this podcast before, but anything really over 40 days is something where we would say, okay, if this is consistently happening, this is a pretty big marker of PCOS. And also anovulatory cycles is very consistent. So Lana was talking about having lower progesterone, and that's typically due to not ovulating. So if individuals might be cycling but not ovulating, that can also be a sign of PCOS.
Yeah, love that. Super helpful too. And if someone is thinking that they have PCOS, I mean, there's so much information, right? You scroll Instagram, you see all of the like, and we all have posts on different things like these symptoms could mean this, these symptoms could mean that. What are some steps that someone can take in terms of determining if that is what they're experiencing?
Like asking what if they suspect they have PCOS, what would be their next steps?
Yeah.
Oh, for sure. Um, so the biggest thing is to get blood work. That's probably the first thing, but you have to be very specific and advocate for yourself as to what you want run. We're actually creating a PCOS course online right now, and I'm creating these different tangibles or like handouts, PDFs that you could have with the course. And one of them is going to be what labs to make, not make your doctor, but ask your doctor to run. And so it's very important. People will say, I'll have patients come to me all the time. Oh, labs were normal. It's because they ran like two things. Doesn't mean it's normal or that the condition isn't there. So the biggest things you'll want to ask for is estrogen and progesterone, LH and FSH. Specifically for estrogen, if you could ask for estradiol, that's probably the best one to ask for. So estradiol, progesterone, LH and FSH. So that's luteinizing hormone, which usually ends up being high in PCOS, and then follicular stimulating hormone or FSH. So those are the important, more like female sex hormones, right? Now you get into the androgens, and you're definitely going to want DHEAS. That guy is so crucial to stress. He is the precursor to all androgens and to cortisol. This guy's also made in the ovaries, so it's really, really important, and in the adrenals to know kind of where the PCOS is coming from. So usually the DHEAS is quite high in a lot of individuals, and you'll want to run a cortisol AM or a cortisol salivary 4-point test, which is basically throughout the day collecting different saliva samples. So that's the sex hormones. I also want patients to go through a thyroid panel. And now a thyroid panel needs to be explained to each practitioner as well, because each practitioner sees it differently. So for me, I like TSH, T4 and T3, but then there's the stuff that actually matters, which is the free T4 turning into the free T3 and also reverse T3. I always like to throw in the antibodies just to rule it out in the beginning. But thyroid is very, very important on how your menstrual cycles are actually working and functioning. And so always run a thyroid. I think that's very, very important. And I think, oh, and then obviously insulin, fasting glucose, and hemoglobin A1C, which is basically measuring, it's a diabetic marker, but HbA1c measures the fasting glucose or your glucose management over the past 3 months or 120 days. And so that's another really, really important one to get run if you're suspecting yourself with PCOS. Image wise, you could get an ultrasound to see if basically a pelvic ultrasound or transvaginal to see if there's any cysts on the ovaries. Now, mind you, you don't need those to show up. You need two of the three things, right? Do you want to go over what the Rotterdam criteria is, Nora? Do you have that on lock?
I don't have it pulled up, no, but I was gonna say like really important that I was gonna bring the same thing to light is that you don't have to have all of those things to have PCOS. So I'm glad that you pointed that out.
Yeah, and the other thing that is a misconception of PCOS is people think that you're always overweight. That's like the stereotypical patient, and that is simply not the case. I have some of the thinnest girls come in and with the most intense PCOS. And so that's another really, really important thing to make note of is that there is no face of PCOS. The more research that comes out, the less that stereotype holds true.
In terms of timing for those labs, I personally have FSH and LH drawn early in the cycle, about day 3. And then I typically wait for the hormones around day 20-ish or so, depending on what your traditional cycle length is. Any variance from that for your recommendation?
I was actually going to say the same thing. I always want my girls to follow their app, follow their menstrual cycle on an app, um, and then go either between days 2 and 3 or 19. Some people are 19, 20. People just want to get started. So if they'd have to wait another long, like 50-day cycle, then if they're bleeding day 1, then yeah, please just go and get it done. And then we'll just take into account where the other hormones are at that time. But those are the two exact times that I also say.
That's because the hormones are low then, is that right?
So that's the time when LH is going to be on the rise as you're leading up to ovulation, and same with follicle stimulating hormone, where in the follicular phase, in that first half, that's where those hormones are ramping up. Whereas in our higher hormone phase, in the luteal phase, that's where we want to capture estrogen and progesterone because we're going to be able to see more of a ratio where progesterone is going to be pretty much non-existent in the first half of the cycle. So that's why you want to do them kind of in 2 different phases.
And as someone listening who's not a practitioner, like all of this can feel so overwhelming. You're like, you might be scratching notes randomly on a piece of paper right now. Like, what test do I need to run? It's like, I think there's also a lot to be said for just finding a practitioner who has some experience with it. And I know that's not available to everyone. But there are so many people that you can work with remotely or, ask around, ask your friends, come into communities, come ask on one of our social media posts. Like this community is big, and I have faith that like you could find someone who has some experience too, if this just all feels too overwhelming.
Oh, for sure. And there's one other test that I absolutely love. But we should make one quick note on the blood work. If you're on birth control, the levels will be depleted because that's just what happens. So just don't be alarmed if everything looks in the tank, because that's exogenous hormones for you. On that same note, the other test that I love, love, love to do is the Dutch test. On patients, it's a functional urinary test for comprehensive hormones. And that I wish that I was like given a nickel every time I talked about Dutch. I think they're the best thing ever. I mean, that would be great though. But I like to do that test as well on patients that are off birth control for at least 3 months. You have to be away from birth control for at least 3 cycles before that test is going to be worth doing to see the results.
Is that true for the blood work too, or you think it's still worth doing blood work on birth control?
I mean, you could see other things on birth control. You could see DHEA, you could see cortisol and insulin and all of that. So it's definitely worth still doing. Just know that the sex hormone portion is going to be depleted. But I also will redo any blood work when they get off birth control. I like the 3 cycles thing, or at least 3 months. I think that it just gives your body a moment to kind of go, oh, and realize where it is.
Yeah, we've talked about like the science behind that too, with that's how long it takes for the whole ovulatory follicle to grow is that 90-day cycle. So that's why it's really helpful to give your body at least 3 months of natural cycling before you draw new labs.
And that needs to be explained to people. My goodness, they just get, like people get very, they want the answers now. And I get it. I would too.
I get it too. Yeah.
Yeah, especially with like, acne or things like that. You want to know. But your body didn't get that way overnight, even though it might seem that way if it's post pill. And patience is super crucial when working with functional practitioners, naturopathic practitioners in general. It takes time.
One thing I really like with the Dutch test is that you can see the three different types of estrogen as well. Whereas when we're getting labs, Lana was saying, like, usually we're just seeing estradiol, which is E2. But what I often see in a lot of individuals that have a lot of PMS symptoms or even in PCOS is that their estrogen, the E2, might be, quote, normal, but they're actually not getting rid of it properly. They're not excreting it well. So then it's repackaged and circulated as E3 in the body. So this test also allows us to see that breakdown and all of its metabolites. So the breakdown pieces that are coming out in the urine so that we can better formulate a game plan. And these labs are essential for us. Like if you have somebody who's recommending or don't start any of these supplements without having labs drawn because they can be catastrophic if they are not appropriate for you, especially things like DIM that I feel like is thrown around willy-nilly, but that's not something to take because you can have a huge rebound effect. That and the calcium D-glucarate, big time. So these labs are really important, really, really important.
I love that. The other thing that I love about Dutch and something that can tie back into the PMDD picture is that Nora was talking about the metabolites of estrogen. I see a really high percentage of women having really high 16-OH, 16 hydroxyestrone. And there's 2 hydroxy, 4 hydroxy, and 16. Choose the protective one that you want the highest ratio of. That's the good one. 4 is the DNA damaging one that's seen more in like hormonal cancers, even colorectal cancer. So that's one that you really want to make sure to decrease that with. And you could easily do that through the Dutch test. And like she said, formulating a game plan by knowing all of the factors. But the 16-OH, that's the guy that has all of the PMS symptoms and all the PMDD symptoms. And that thing could be like they have a pie chart. That thing could be 80 to 85% of the pie chart. And you're like, oh, this is where I start, obviously. And they immediately get symptomatic relief, usually after that first cycle.
Super interesting.
All the good things. If you were to pick like one or the most important piece in PCOS treatment, I know it's hard to boil it down to just one thing, but what do you think is the most important piece when it comes to PCOS management?
I know it's going to sound blanket, but keeping your cortisol in check, really managing your stress because stress will drive anything into an imbalance. It sometimes takes overnight, sometimes it takes a long, slow burn. But if you can manage your stress through a variety of different mechanisms, that's going to be the best. That's going to set you up for the most success throughout any treatment you do.
I couldn't agree more.
It's such a big one and it's so hard to tackle too, right? Like we're like, what does that even look like? And it can be something as simple as going outside daily, taking a walk, like the really simple things, but it's really hard to do.
Yeah, honestly, most all things can wait. I know people think that deadlines are super important, but you only have one body, one mind, one everything. Most things can wait, and you could take some time for yourself.
I agree. Okay, we didn't prep you for these, but they're very easy to answer. We always do this little lightning round for our listeners just to get to know our guests a little bit more. So, in lieu of stress management, what is your favorite form of self-care?
I love being outdoors. I actually left New York for Colorado for an extended sabbatical, and this has brought my personal DHEA was sky high, and it has dropped 300 points, which is insane. It was in the 500s, which should say something about the stress level and what it's done, even after just being here for 2 months, being outdoors.
I love that. Forest bathing is real. Like it really helps.
Yes.
Okay, next question is what is your favorite meal to cook?
I'm okay. This isn't cooking because I don't know how to cook. I juice everything. So I juiced a grapefruit, orange, golden beet this morning, and I'm very proud of myself, and it's delicious. So juicing's my answer.
I love that. That's okay. We don't have to cook.
Do you prefer your morning routine or your evening routine?
Oh my gosh, morning, 100%.
Tell us about it.
Um, since being here, I'm really trying to wake up slow, which is a whole training in and of itself. Wake up slow, go to the coffee pot, look at the mountains, make my juice, and then what I'm trying to do right now, which is very hard because I'm staying on East Coast time and my patients start at 10 a.m. and I'm by that time it's 8 a.m. here, is I usually get a workout in. But that means I'm waking up at 5 here, which I do in New York and have no problem with. But if I don't do that, the day gets away from me and then I'm spending my entire day helping everyone else but myself, and that's not okay. That's really not. So I learned that the hard way.
Yeah, we have to take care of ourselves first.
Yeah.
What is a book that has had the biggest impact on you?
A Return to Love, hands down. We didn't talk about this. Marianne Williamson, oh my gosh, she had me crying on page 4. Again, not a crier, pivotal moment.
I don't know. I don't know. You might be a crier.
No, I'm not a crier. These 2 times, these are big moments in my life. Y'all are just asking the right questions.
Okay, I wrote it down. I'm going to have to add it to my list.
So good.
Amazing. Well, thank you so much for coming on and sharing with us. Where can our listeners come and find you and learn more about your work?
Of course. So it's the website is drlanawellness.com, DRLANA wellness.com. Instagram is the same, so at DRLANA wellness. We have TikTok, it's the same. And then I work with patients virtually, which is wonderful. And you could be in any state, some different countries as well. And so, yeah, I am around, and I'm more than happy to answer DMs or contacts through the website.
Amazing. We will link your website and your Instagram below. So if anyone has questions, please do reach out. And thanks so much for being here. We'll see everyone next week.
Thank you.
Thank you so much. This has been amazing.